I'm Esther Smith, and this is Dan Mirsky, climbing coach and also climbing athlete. We want to walk you through a little sequence on what to do if you've acutely injured your flexor tendon or pulley. And this works for acute for sure, and it's important to get started moving right away so that the finger doesn't stiffen up, and you want to start to kind of get some assessment or inventory on how bad the issue is by kind of going through some of these little skills. So if you think that you've hurt your flexor tendon or pulley, you've heard a loud pop and you have that sudden onset pain and weakness, the first thing you want to do is not touch a climbing hold. And the best thing to do is immediately ice it and then get started on these exercises. So Dan's going to walk you through this little sequence, and really the sequence is to start with a straight hand, and then to take it into like this little briefcase grip. And what that does is it just partially glides the tendon. You take it back out, and then you take it into this flat palm grip, and that glides the tendon some more. And then you take it out, and you go full fist for full glide, full shortening.
So I've found these tendon glides to be not only useful as an injury assessment tool, injury rehabilitation, but I also just use them in my daily climbing life to warm up my fingers, maybe as I'm just walking to the crag, or thinking about my rock climbing project for the day, or getting ready to climb and train in the gym.
Take a pen or a pencil or a fatter marker if you can't do this with something narrow, and you make that first position of the tendon glide. The back of the hand is flat and those knuckles are all kind of square top, and you roll the pen or whatever sort of utensil you're using up into your fingers this way, and you try to get every finger involved, and you just check it out. How does that feel? Again, it kind of glides the tendon, but it also strengthens and creates dexterity of all the intrinsic hand muscles of the hand. And you might find that one hand's a little dumber than the other, so check that out. One finger might be more dumb than the other. And you might need to start with like a fat pen or Sharpie before you graduate to the small pen or number 2 pencil. And the big thing here is keep the back of the hand flat, and you kind of keep that first position of the tendon glide the whole time. See how coordinated Dan is?
Better with my left.
Tool is to use one of these handy finger massage tools that you can use it to massage out any of your fingers, which is awesome, and you can work the kind of front, back, and then sides of the finger as well. And then you can work down into the palm, which is actually really important when you do injure a finger, to kind of work into where the tendon's actually entering into the finger as well. It can be pretty sore, especially if you injure it more close to that base knuckle. Good, so yeah, lots of different varieties and technique, but just spend a little time. If you're acutely injured, it's gonna be kind of sore and tender, so stay away from that raw zone and just work around it. But basically you don't want to develop a bunch of scar tissue. You want to just keep that tendon moving, keep blood flow, limit the inflammation, and make sure that you maintain your range of motion.
Another handy tool you can buy on Amazon is an acupressure massage ring. And you sort of do the same thing as you would with the massage tongue.
Yeah.
And it's just an action of rolling it up and down your finger, again to stimulate blood flow, break up scar tissue.
Alright, next exercise is to get into some grain, and in this case we have wheat berries instead of rice because I think it's more gentle and it's nice if you're actually acutely injured, to be able to go through some resistance and again kind of take assessment, start to condition the tissue a little bit. So Dan's going to do 3 finger motions in here. First we're going to start with stabbing in and doing extension and pulling out, and then stabbing in, flexing, gripping the rice, pulling out, going in for the 3rd round and doing those lateral kind of twist motions. additional thing to focus on if you've acutely injured a flexor tendon or pulley is to actually stretch upstream from that so that you can floss and get some length through all of the tissue that that finger tendon is connected to. So go ahead, Dan, and we're going to have you on this foam roller. You're just going to do those snow angels or floor angel type motions. Going up overhead all the way, keeping your thumbs oriented towards the ground, but then making sure that you're stretching through your fingers so that your fingers can kind of straighten out. You might even bend back those wrists so you get a little bit more of a stretch delivered into the forearm and into the hand. And then you can kind of do some of those side-to-side motions where you stretch one side in particular more than the other. Good. Just because you don't want that tissue to kind of zipper up on you. So you want to maintain length all the way through the individual finger, the palm, the wrist, the forearm, and all the way up.
And as I'm pantomiming the moves on my rock climbing project,
Oh, nice.
which is like patting your head and rubbing your stomach.
Yeah.
Did you get that?